Hi everyone, this video is about the step-by-step procedure of inserting a peripherally inserted central line PICC line in a patient. We had a young male cancer patient with coagulopathy presenting to ER for central line insertion, but because of the obvious coagulopathy we could not attempt a subclavian or an internal jugular vein. So that is why a PICC line was considered. Now before inserting a PICC line, obviously you should know the indications and contraindications of inserting it. Once you know that a PICC line is suitable for this patient, then you'll go for measuring the length or the adequate length of insertion of the catheter. That goes from the third intercostal space, parasternal, or roughly the just below the sternal notch, and then measuring it till the acromion process of the side from where you want to insert. Suppose it is the right side, so you'll measure the sternal notch till the acromion, and then from acromion you'll measure the length till the vein that you have chosen, either a cephalic vein or a basilic vein or any vein which is good, well visible in the ultrasound. So once you have chosen the vein, once you have chosen the length of insertion, let's move on to the exact procedure from pricking the vein till the insertion of the catheter. Let's see. So let's look at the steps of inserting a PICC line. First, you choose a good vein, either by palpation or by ultrasound. Then you insert your needle and aspirate blood into a syringe containing 1 to 2 ml of normal saline so that no air gets inside. Once there is free blood flow through the needle, you start inserting your guide wire through it. Remember, while inserting the guide wire, the needle should be as stable as possible and the guide wire should not feel any resistance. Any sort of resistance while inserting the guide wire, you should abandon the procedure, relocate the needle. Once the guide wire is inserted, you put a gauze piece at one end and remove the needle. Now, obviously you have to insert a sheath, a big sheath through which the catheter will be going inside. So you have to give a small nick at the junction of the skin and the guide wire, so that this sheath that you can see on the screen is easily inserted through the skin. Otherwise you won't be able to penetrate the thick skin with this blunted tip of the sheath. Then while inserting the sheath, with a considerable force may be there at the beginning, the other person should be holding the guide wire at the other end. You can see the one person is holding the guide wire, so guide wire doesn't go inside through the sheath, and the other person will be putting the sheath inside. Once the sheath is inside and the whole assembly is in, now the guide wire has to be removed. Once the guide wire is removed, you can see that sheath within sheath. So this sheath, the inner sheath, is actually removed first. Once it is removed, a lot of space is formed through which the catheter can be inserted. This catheter has markings. Depending on the size, it has 50 to 55 or 60 centimeter markings. We have already measured the length to be inserted, so we are inserting it till the mark 50 centimeter mark, so that the rest of the guide wire, the rest of the catheter remains outside. So you can see the catheter going inside. Once the catheter is in, I have to aspirate for the blood. Once there is blood, the outer sheath is actually a detachable sheath. You have to break it open and remove it like a sleeve. Keep inserting the PICC line in between, because while removing this outer sheath by breaking, there's a possibility that the PICC line may come out. So you keep inserting the PICC line, and along with that keep stripping the outer sheath like this. Once whole of the sheath is removed, the PICC line final mark till which it should be inserted should be confirmed again, and that's all. You have to re-aspirate for the blood. You can see the person is re-aspirating, there's blood in the column, and then keeping the syringe in vertical position and then injecting saline will prevent the air to go inside. So this is easily flushable. Aspirating again, blood is there. Then we have to lock it so that no air can get inside. Similarly, the other port, because this is a 2-port catheter, the other port has a guide wire to make it stiff enough for insertion. So this guide wire, which is inserted, which is already there in situ in the catheter, should be removed. Then again putting a syringe filled with saline, aspirating for blood, and you can see the blood is freely coming, pushing it back, locking the catheter, and then just you have to do the aseptic dressing, which comes with the set, and you are done with the PICC line. Thank you so much.